Okay, so hi and welcome to an introduction to bariatric surgery. I'm Sarah Mathias, the advanced practitioner in the team, and joining me is...
Hi there, I'm Lauren. I'm the therapy assistant on the team.
So the following video will give you an overview of the bariatric procedures and the pathway to surgery, and we ask that you note any questions down and you bring these to your baseline group session for further discussion. So in the UK, access to bariatric surgery sits within a tiered system of weight management services, and patients often describe their journey as feeling like a little bit of a roller coaster full of highs and lows and delays, and they're required to jump through multiple hoops or tick money boxes before reaching surgery, a bit like the picture on the right. But once you enter Tier 4 surgical pathway with us, the journey doesn't stop. In many ways, it sort of starts again. And this stage is about preparing individuals to get to surgery safely, while reinforcing and building upon those positive lifestyle and behaviour change that you've already started through the weight management programme. And the focus is not just on eligibility, but embedding these strategies that will support long-term success after surgery. This is from changing nutrition and activity to psychological readiness, and ultimately the pathway aims to ensure that when you reach surgery that you're not only ready for the operation itself, but you're also ready for the new life that follows behind it. So we're quite a small team. We have two consultant surgeons, Mr. Richard Byron and Mr. Nick Davies. I'm Sarah. We've got a specialist dietitian as part of the team. Lauren is on the call with me today. She's our senior bariatric therapy assistant. And if you phone the office, you'll likely speak to Sandra, who is our office manager. Bariatric surgery is not for everyone. There are clear criteria set out by NICE guidance, which is a national guidance, to make sure it's offered safely for those who will benefit most. So surgery is usually considered for adults with a BMI over 40 or a BMI of over 35 with weight-related comorbidities like type 2 diabetes, high blood pressure or sleep apnea. It's important that everyone is fit for surgery, so this means being medically well enough to have a general anaesthetic and working towards healthy lifestyle changes and showing commitment to that follow-up care that's essential after the operation. Surgery is not a quick fix. It is part of a long-term treatment plan that includes lifelong nutritional supplements, regular blood tests and ongoing support from the bariatric team. Each one of you here will have your own personal reasons for considering this journey. For some, it's about improving health conditions like diabetes, blood pressure, or joint pain. And for others, it might be about feeling more comfortable, having more energy, or being able to do things that feel kind of out of reach for you right now. So weight loss can bring about both physical and mental health benefits. Physically, it can reduce the strain on your heart, joints, your lungs, and improve mobility and lower the risk of any other serious conditions. And mentally, most people notice improvement in mood, maybe confidence and self-esteem, and a greater sense of control in their daily lives. But it's important to remember that it's not just about the number on the scales, it is about quality of life and how you want to feel in the future. It's important to understand that bariatric surgery isn't designed to be a physical stopper to eating. Instead, these procedures are tools to help you feel satisfied, smaller portions, without being left hungry afterwards. The aim is early satisfaction, not restriction. So surgery doesn't decide what foods you choose, how quickly you eat, or whether you eat for reasons other than physical hunger. Those are areas where your lifestyle changes and your new habits make the real difference. So think of surgery as giving you an extra layer of support to build on those positive changes that you're already working towards. Bariatric surgery is best thought at as a tool. We say this quite a lot, and something that works alongside all the efforts and those lifestyle changes, not instead of them. So one key way it helps is by changing hunger and satisfaction signals, as we've mentioned. So after surgery, many people notice that they feel satisfied sooner and stay satisfied for longer, making it easier to manage those smaller portion sizes. There are also powerful appetite changes at play here. Surgery can influence the hormones that control appetite and hunger, which means you may experience less drive to eat and find it easier to focus on healthier choices. But most importantly, weight loss and the change that comes with a successful surgery outcome can improve quality of life, from mobility and energy to mood and self-confidence. The journey isn't just about that number on the scales, as we said, it's about feeling better and being able to do more of the things that matter to you. It's important to be clear that surgery is not a quick fix or a cure. While it can support significant weight loss and health improvements, it may not always meet your expectations every time. And over time, some degree of weight regain is a normal part of this journey. However, this usually does not mean returning to the starting weight, and most people maintain a meaningful and lasting benefits. So your surgery will be carried out under general anaesthetic. You'll be fully asleep throughout. These procedures are performed laparoscopically or keyhole, which means about 5 to 7 small incisions are made in the abdomen to allow cameras and instruments for the operation to go safely and precisely. Most people will stay in hospital just for one night, and before going home, we'll make sure that your pain is well managed, you're tolerating fluids comfortably, and you're able to move around the ward safely. The early recovery period is an important step in preparing you to continue your journey safely to going home. So there are 3 main types of bariatric surgery we offer: the gastric band, the sleeve gastrectomy, and the gastric bypass. So the gastric band is no longer commonly performed, so it isn't covered in this presentation. However, if you would like more information about the band, please do let us know and we can discuss it with you in more detail on a one-to-one basis. So the sleeve gastrectomy usually takes about an hour to an hour and a half. In this procedure, the surgeon removes about 3/4 of the stomach, leaving a narrow tube or sleeve shape. And this means that the stomach holds much less food before sending signals to the brain that you are satisfied, and reduces those hunger hormones, helping you to feel fuller and satisfied longer. The procedure might not be recommended if you suffer with pathological, that's severe reflux, as reducing the size of your stomach in this way can cause a high pressure, which can make these symptoms worse. If you have reflux or a diagnosis of a hiatus hernia, please do let the team know, and we can then discuss this further with you in your clinic appointments. There is sometimes an option to fix the hiatus hernia at the time of surgery if a sleeve is your preferred operation. So the gastric bypass is a slightly longer operation, taking about 2, maybe 3 hours. Here the surgeon creates a small pouch, then connects this pouch directly to the part of the small intestine. Food then bypasses most of the stomach and the first part of the intestine. And this not only limits how much food you can eat before you get those signals to your brain that you're satisfied, but also changes how your body absorbs nutrients and affects hormones that regulate appetite. This procedure might not be recommended if you have certain inflammatory bowel conditions such as Crohn's and colitis, or a history of gastric cancer, or if you require specific medications where the absorption can't be guaranteed, and this can sometimes be challenging. Both procedures, or all procedures, are effective tools to help support weight loss, but the choice of operation depends on your medical history, lifestyle, and what will be the safest and most effective for you in the long term. When it comes to choosing between the surgeries, there isn't a single best option that suits everyone. Both procedures are safe and effective, and both can support long-term weight loss and health improvements. The decision is usually based on your individual health, the history, your lifestyle, and your preference. But ultimately, the choice is a shared decision between you and the surgical team, and we will give you the information and talk you through the risks and benefits and guide you on what may be the safest and most effective, but your own goals and concerns and preferences are central to this final decision. One of the largest UK studies looking at bariatric surgery is the bi-band sleeve trial, which compared the gastric bypass, the gastric band, and the sleeve gastrectomy. We were part of this trial with 13 other centres across the country, and it had over 1,400 patients in it. The main outcomes the researchers looked at were long-term weight loss and quality of life. In the first few years after surgery, the gastric bypass showed a slightly higher weight loss and greater improvement in quality of life compared with the sleeve gastrectomy. However, over time, the results between the bypass and the sleeve evened out. with both procedures showing similar levels of maintained weight loss and ongoing benefits to quality of life. This evidence helps explain why the sleeve and bypass are now the most commonly offered procedure, while the band has largely fallen out of use, perhaps. As with all surgeries, bariatric surgery carries small risks of complications, and here we see a list of potential complications, and it's important to bear in mind that some of these are more likely than others, and some people do not experience any of these at all. Syndrome is a complication specific to gastric bypass. It's caused by your body reacting to sugary foods being dumped into the new pathway, and it can occur sort of 10 to 20 minutes after eating or a couple of hours after eating. And this can lead to a range of symptoms from feeling tired, hot, shaky, to experiencing nausea and diarrhea. Approximately 1/3 of people will experience this, but it can be managed by reducing the amount of carbohydrate in your diet and working with a specialist dietetic team. With a sleeve gastrectomy, a possible complication is reactive hyperglycemia. This is where your blood sugars will drop quickly after they've spiked, and this is associated with eating, leading again to feelings of shaking, confusion, maybe tiredness. But again, it's about dietary management to help manage these symptoms. But for both the sleeve and the bypass surgery, there's a small risk of leaks and bleeds from the staple lines. Rigorous checks are performed during surgery to check for these, and you're closely monitored following surgery to try and reduce the risk of this happening. Nicotine is the biggest risk factor for these occurring. But with both the surgeries, it's possible not to lose weight as expected or to regain weight. This is because surgery is a tool that enables you to make those lifestyle change. And if you do not make these changes to your eating habits, then it's unlikely that weight loss surgery will lead to that sustained weight loss. Vomiting and regurgitation is not to be expected after any of the surgeries. If you are experiencing this regularly, we would encourage you to speak to the team for advice. This is usually resolved with some adaptations around your eating behaviours. One of the side effects of significant weight loss is excess loose skin, and it's important to remember that there is currently no funding for removal of excess skin within the NHS, and that some people can find this quite problematic. There's no exercises or supplements that can influence the amount of loose skin you have, and this is largely down to genetics and age. Intolerance to lactose and vitamin and mineral deficiencies or insufficiencies are all possible, which is why we recommend lifelong supplements and regular blood tests, which are essential in that post-op follow-up period. Constipation is one of the most side effects that we see. There are a few reasons for this: the pre-surgery liver reduction diet and the post-surgery diet. Your portion sizes are much smaller, so you naturally take in less fibre and fluid than you did before surgery. Also, the pain relief medicine used around the time of surgery can also slow down your bowels. On top of that, your body is adjusting to the change in diet and digestion. The good news is that constipation can usually be managed by keeping well hydrated and making the most of fibre-rich foods that you can tolerate, staying active and sometimes requiring gentle laxatives if needed. It is normal after surgery, and with the right strategies, it can often improve quickly. We ask that you're mindful and speak to the team or your local pharmacy for advice. It's quite common for people to notice some hair thinning in the first year after bariatric surgery. This happens for a couple of reasons. First, the body goes through a big stress response after surgery and rapid weight loss. And one of the ways it reacts is by temporarily pausing hair growth. This type of shedding, for anybody who wants to know, is called telogen effluvium. Posh name, and it usually starts a few months after surgery. The second reason is because your food intake is much smaller, so it can be harder to get all those proteins and vitamin and minerals that your body needs to support healthy hair growth. And that's why we emphasise the importance of protein and following the recommendations for the mineral and vitamin supplementation. The good news is that this hair loss is usually temporary, And as your weight loss stabilizes and your nutrition is supported, your hair growth typically will improve again over time. So this loss list can sound worrying, and it's important to remember that surgery is very safe overall, and most people experience more benefits than problems. We go through these risks with you so that you feel fully informed and prepared for the journey ahead. So weight loss pharmacotherapy. So there are these medicines available now that can support weight loss. And some of you may be already self-funding these treatments. So it's important to explain how they work and what you can expect. So these medications act by mimicking hormones in the body that help regulate appetite. They work on the brain to reduce hunger and help you feel satisfied sooner, making it easier to manage portion sizes and reduce your calorie intake. But like all treatments, they can have side effects, and the most common are nausea, constipation, diarrhea, and sometimes some abdominal discomfort, which usually can improve with time. In Dorset, weight loss medications are now being provided through the NHS, but access is limited. Within our Tier 4 bariatric service, we are finalising a pathway, but criteria will be restricted due to available funding. The same is true of the newly commissioned community weight management service, where medication will only be offered to individuals with a BMI of over 40 and 4 out of 5 specific health conditions that are weight related. So while these medications can be an effective tool like surgery, they're not accessible to everyone, and they work best when combined with lifestyle and behavioural change.
Hi there, so my name is Lauren. I'm a therapy assistant on the team. So general health and wellbeing. Looking after your general health and wellbeing prior to surgery could be hugely beneficial. So letting us know if we can help you, or if you've got any ongoing concerns regarding your physical, mental or social wellbeing. So speaking with us is not just about what you ate for breakfast, but how you are on a day-to-day basis. So this can include keeping us updated with update from your GP regarding your blood pressure medication, or you starting on HRT, or referral to the sleep clinic or physio. Additionally, mental health and well-being, so letting us know of any ongoing stress or worry. Some of you may have come across steps to well-being before. So this is a resource that you can self-refer to for further support. We've additionally included a "Am I ready for bariatric surgery" information into your packs to help you question this. Smoking and vaping with nicotine. So this is a key aspect as part of your patient contract, and it has put a delay on some patients progressing with surgery. So this is a prerequisite that you need to be smoke and nicotine free prior to surgery for at least 3 months and lead up to surgery and prior to meeting with the surgeon. This is to prevent any breathing complications and to promote effective wound healing post-surgery. Therefore, the surgeon does have the right to counsel you on the day of surgery and not to add you onto the waiting list until you are smoke and nicotine free. So we do bring our breathalyzers into clinic, looking for 3 marks in the green zone before putting you through to meet our consultant surgeon. Speaking with your GP or smoking cessation team about any advice that can help you with this, it is really important that you can be compliant with this in both the lead up to surgery, but then also post-surgery, as your staple lines are titanium, so they are lifelong, and it's important to reduce these risks for your leaks, bleeds and ulcerations lifelong. Alcohol, so we recommend you abstain from alcohol 3 months prior to surgery and then 6 months post-surgery. This is based upon the knowledge of addiction transference. So if you're coming into clinic and we're recommending that you change out some aspects of your diet, maybe reducing your ultra processed food, that previously gave you that feel good factor, we don't want you to use these trends to transition into alcohol consumption. So we have included an alcohol questionnaire as well in your packs, so fill us out when you can and send them back. So if you drink socially, if it's your birthday, Christmas, that's fine. I think we just need to monitor if there's any habitual drinking or episodes of sort of binge drinking. Okay, 6 months post-surgery, so we recommend we encourage you to be mindful that alcohol could be also known as empty calories, so little to no nutritional value per the amount of calories that you are consuming. So we promote you eating your calories rather than drinking them, as we can consume a higher amount of calories quicker without realising it for drinking. This is where an eating technique will come into place later on. So alcohol can also induce dehydration and reduce your nutrient absorption. There's also a heightened risk of intoxication as you'll be on much smaller portions post-bariatric surgery. It's quicker for your blood alcohol volume and to present in you feeling drunk quicker. So definitely something to be mindful of if you choose to reincorporate alcohol post-op. Recognising emotions. So bariatric surgery is a great tool in helping you feel satisfied on smaller portions on that regular meal pattern, but it doesn't influence what or why you are eating, and that's behavioural and in your control. Surgery also doesn't stop you eating outside of those times. So taking the time pre-surgery to reflect on these times that we may eat as a response to head hunger and not always true physical hunger. So we've included emotions here, such as feeling sad or stressed or angry or bored, but we've also included some positive emotions here too, like feeling happy. How many of us eat differently when we're out socialising or celebrating? So post-bariatric surgery, when you're feeling these emotions and your previous coping strategy has been relieving that emotion with food, but now this doesn't align to your long-term goals of creating a calorie deficit. It's not just emotional eating. We can refer to it as non-hunger based eating, so eating for those non-hunger based reasons. So often we can eat differently around different people. Oh, it's sunny today, it's a weekend, we're going to the cinema. We get those changes in desirability and cravings at different times. So if you do identify to particular triggers, oh yes, I do eat differently when I'm around my friends or family, or when I'm stressed, or when I'm sad, or when it's the weekend, when I'm on holiday, reflecting on these. So we're bringing these to your attention now because we feel that these are emotions and events, such as Christmas, that aren't going to change post-bariatric surgery. So the cycle of non-hunger based eating, maybe this was introduced to you during the Tier 3 programme, but so we've used the example of feeling stressed. An event occurs, and traditionally we'd have gone to that good old comfort food to help ease that emotion, or at least we think it helped at the time. So the cycle of non-hunger based eating, this may have been introduced to you during your Tier 3. So for example, something happens, we've used the example of feeling stressed. You can fill in another sort of emotion if it's more appropriate to you. We go to those good old comfort foods that have helped to ease that emotion, or at least we think it does for a set amount of time. Those we get those feel-good hormones lighting up like a Christmas tree in our brain. It helps us feel calmer at the time. But maybe half an hour or so later, we may experience feelings of self-guilt, criticism, and can feel frustrated in our response. And the weight can go up, and we can go around this cycle. Maybe some of you can identify with this. So we're aiming to break that cycle. So we're trying to incorporate a pause here. So we're trying to encourage you to respond to an emotion rather than react to it. And this is where delayed distracted desire can come in. Okay. So when you're feeling this emotion, your automatic go forward is to go to that good old food item. But what other options can help ease that emotion? Could it be calling a friend, watching something funny on TV, going for a walk around the block, changing the environment or in which the trigger or craving may be originating from, and going back to it half an hour later thinking, okay, do I still want that piece of food, or has my emotional situation changed? The technique is about encouraging you to respond to healthier coping strategies rather than reacting to what we may have previously done. So even the word treat, most of us would associate with a food item, but why not? Why can't other strategies be available for us? So thinking, what are my triggers and what are my coping strategies? What could be some of my non-hunger based rewards? We'll introduce you to the concept of intuitive eating, so eating with and applying sort of mindfulness as well. How many of us eat on the go whilst we're driving, answering an email, watching TV at the same time? So events like this can make us less in tune with what we're eating, and this is just as important as what we are eating. So considering how can I incorporate more mindfulness into my eating? Could it be sitting at the dinner table whilst eating food, and actually taking the time to sit, taste, and enjoy our food? So intuitive eating is taking the emotion out of food, not referring to food as good and bad foods. We know we put that on that pedestal, that desirability shifts up when we do that, and listening to our internal satisfaction cues for hunger and satisfaction, not relying on external cues such as when the plate's empty or when the packet is empty. Okay, so the liver reduction diet. So everyone will have to complete a liver reduction diet pre-surgery. Perhaps some of you have had to complete a liver reduction diet for another abdominal surgery. So the liver is the largest internal organ in the body, and it sits completely right in front of where the surgeon needs to get access to complete your surgery safely. So when we eat food, we store carbohydrates in the form of glycogen into our liver, and that's what we need to shrink. So the aim of the diet is to use up all those stores of our glycogen as energy to shrink the liver. Okay, so we were part of a study a few years ago, and the outcome was that the gold standard for shrinking the size of the liver was the milk and yogurt diet. Okay, so this diet consists of 2 pints of semi-skimmed soya or lactose-free milk, 350 grams of yogurt, needs to be 60 calories or less per 100 grams, an additional 2 litres of decaffeinated sugar-free fluid. Okay, this is the main structure of the diet that all patients will have to be on in the lead up to surgery for 3 to 4 weeks. Okay, so the 3 to 4 weeks is predetermined by your gender and your BMI. So the higher your BMI, the longer you have to be on the liver reduction diet. We can calculate whether you'll be a 3 or 4 week liver reduction diet in your one-to-one appointments. Okay, so it's really important that you can be that you feel you are confident in completing the diet correctly, and have a good understanding of what the diet is like on your day-to-day routine. So we do recommend that you trial the diet for 7 to 10 days in the lead up to surgery. Okay, so it is safe for anyone to trial. I've trialed the diet myself for 10 days. We just say that anyone on diabetic medication other than metformin, please do speak to your diabetes team prior to trying the diet due to that change in fibre, so getting your diabetes team to sign you off on this diet. Okay, so on that note, that dietary fibre and the amount of dairy that consuming, we're probably not used to. So common side effects is often constipation. If this does happen, it's important that you act on it, and if you aren't opening your bowels within a day or so of your normal sink, speaking to your pharmacist or asking us for further advice. So we do recommend that everyone does trial the diet and let us know how you get along with it at your one-to-one appointments, and speak to us about what went well or further advice for next time. Any concerns about the diet itself, about the dairy aspect of it, any sort of allergies or intolerances, please speak to your specialist dietitian at your initial appointment. Okay, so the texture build up, so you completed the liver reduction diet, you've had your surgery, so the next day you'll be on fluids only. We'll come to the ward the next day to make sure that you're drinking and keeping your fluids down before we send you home. So you'll be on thin fluids for the rest of the week, then incorporating thicker fluids on week 2. The rest of the texture build up stages on a week by week basis, and it's important that you stick to this. Okay, we hope to see you back to normal textures by approximately week 6. Okay, So eating techniques and eating after surgery. So the texture build up is that initial 6 weeks. The eating techniques are lifelong. So these are strategies that we'd like you to encourage you to incorporate as much as you can now, as a bit of that muscle memory, as the new way to eat post surgery. Okay, so 2020 is the key eating and mindfulness technique that we promote patients to embed pre-surgery to assist with that transition post-op. So it's based upon the concept of not eating too much, chewing thoroughly enough, and eating over a certain amount of time. So eating bite-sized pieces of a 20p coin, chewing 20 times, taking a 30-second to a minute break in between bite sizes, and eating for a 20-minute period. Okay, so patients often ask what their portion sizes are going to be like post-op. If you cut up your meals, like you may do for your children, allocate those 20p bites on your plate. That's your portion for your meal. Protein, you're then going to split half the 20 bites into protein. So protein is really important to be having post-op. Protein is essential for the growth and repair of your body tissues, and to protect that lean muscle mass, so your muscles whilst you're losing weight. Protein also helps us feel fuller for longer because it takes a longer time to digest. So, and considering now how can I incorporate more protein across the day, many patients find more success with smaller, more frequent meals focusing on their protein. After surgery, it can make it, as you're on smaller portions, it's more challenging to ensure you're getting in enough protein. So we recommend you eating your protein first and aiming for between 60 to 100 grams of protein a day. Okay. So stopping when you feel satisfied, this is a really important, and hopefully the 2020 will help you to do that. So as you're slowing down for your eating, it will allow your brain to catch up on what you've eaten so far. So recognizing those internal satisfaction cues that you're feeling comfortably satisfied rather than feeling full, stuffed and bloated. We'll introduce you to the hunger scale as a spectrum of sort of 0 to 10, which we'd encourage you to experiment with different food and questioning what is keeping me satisfied for longer. It also goes back to that the rule of thumb of the satisfaction, not restriction. Okay. So other nutrients to consider are your dietary fibre, and increasing your whole grains, your fruits, your vegetables, your salads during this time. We'd recommend you have a reduction in your carbohydrate portion, which can occur naturally due to having a higher protein and fibre intake. So considering how can I make my favourite meals representative of 50% protein and a quarter carbohydrates. Drinking. So we recommend that you do not drink with your meals. This is to prevent food swelling and causing a food bolus, and potentially which can sort of stick. Drinking can also fill up your pouch and prevent you from consuming as much food as you need for satisfaction, resulting in you feeling hungrier earlier. So fluid can also flush through what you've eaten so far. So we do recommend that you separate your drinks by about half an hour either side of your meals. However, not a lot of us know when we're going to be eating or have that protected lunch break. So working on your fluid consumption across the day and taking more sips when you can. So carbonated drinks, so post-surgery carbonated drinks are not recommended as the bubbles can be quite painful and cause that bloating, regurgitation and general discomfort. So this includes your fizzy, your sort of tonic waters and sparkling waters as well. So starting to reduce this when you can. Supplements. So everyone will be started on a standard supplement regime. Having a balanced diet can reduce the risk of nutrient insufficiency and deficiency, but because of the nature of your surgery, we do start patients on a standard regime for supplements. Okay. which is particularly important for those having the gastric bypass due to the change in pathway of food, which is now escaping the duodenum, where we absorb most of our nutrients. So you'll be started on an A to Z multivitamin and mineral tablet, add your calcium and vitamin D, and iron, which you will need to self-fund. Your GP can start you on the vitamin B12 injections every 3 months, 6 months post-bariatric surgery. Also speaking to us of any side effects that you're getting post-op in your dietetic appointments. It may be something that we'd be able to identify is connected to a vitamin or mineral insufficiency or deficiency. You will have regular blood tests, so we can pick up these and we can treat them. Excess skin, so currently there is no provision of funding from the NHS to help them with the removal of excess skin post-bariatric surgery. And we're bringing this to your attention now. I guess we have lots of patients who are worried about that in a few years' time. But if there is weight to lose, excess skin is going to be a part of that, and to make to be considering during this pre-surgical pathway. So the main influences on excess skin are your genetics and your age. So things like exercise can tone the muscle underneath the skin, but doesn't have any clinical significance on your skin elasticity. So taking this time to reflect on your earlier goals for your reasoning for bariatric surgery, what do you hope to get out of this? And actually, if your hope is to pursue with other surgeries or reduce your BMI for something else, or improving your quality of life, having a reduction in your medications, having that hip surgery done, whatever it may be, just talking actually how is excess skin going to be a part of this, but talking with others, maybe you know anyone who's had bariatric surgery before, how have they managed, but how do you think that you will manage with this? Changes post-surgery, so it's believed that it can be a change in your taste and smell due to sort of fluctuating hormones, that changes in your stomach and sort of intestinal tract. So potentially that foods that you once craved just simply don't taste like what they did pre-surgery, or food that is sweet now may be too sweet for you post-surgery. Just something to be mindful of if you are shifting all your carbonated drinks to one flavoured fruit squash, because you don't like water, but that fruit squash may be too sweet for you post-surgery. Unable to tolerate certain textures, we are aware of foods that could be problematic post-surgery. That food feels like it gets stuck, and you just can't tolerate it, despite doing the 20-20-20. So those foods tend to be sort of chewier or dry meat, more fibrous fruits and vegetables, like kernels, sweet corn, cauliflower, broccoli, and these sort of nuts and seeds. So actually, we don't want you cutting these out completely. It's finding a different way to sort of eat them. Actually, do I cook this beef differently? Do I put it with a sauce, and actually I can tolerate that a bit better? Do I just peel my apples instead? Okay, because avoiding those problem foods can increase our us opting for those sloppier, what we call slider foods. So maybe your soups, your smoothies, ice creams. So foods that you're not doing a 20-20-20 with. But these are going to travel through quicker through your stomach, and you're not going to get those stretch receptors going off, highlighting that you've had enough. So these can make you left feeling hungrier quicker, and getting slower results in your weight change. So letting us know if you have any difficulty with these problem foods. There shouldn't be any particular food that you can't or should be having post-operatively. Bowel habits, so particularly during the early post-operative stages, it can be difficult to get in enough fibre as you're focusing on your protein. So here, just breaking the stigma about talking to us about your bowel habits. We're so used to it, and don't feel that you can't talk to us about this. We can help you from a dietary perspective, increasing that dietary fibre, your fluid intake, or advice on some over-the-counter medications for you. So these are some of the comments that we've had previously on the group session. So bariatric surgery is cheating. It's not cheating at all, and questioning the knowledge of others in your support group if they're saying that it is. We know it works as a tool to support your positive diet and lifestyle changes and shouldn't be seen as that. You're all here for your own reasons and for those long-term health goals. Bariatric surgery is dangerous and leaves a big scar. So in terms of being dangerous, surgery is surgery, but everyone will meet with the consultant surgeon and attend a fitness assessment to check they are physically fit for surgery. No big scars. All our surgeries are performed laparoscopically, so 5 to 7 port sites all above belly button, no open surgeries. Weight loss surgery is a quick fix. So yes, we do see that initial weight tracking down in the first few months, but bariatric surgery is there as that long-term weight maintenance tool to work alongside your diet and lifestyle changes. I'll never be able to eat normal food again. So after surgery, yes, you are on that texture build-up stage, and it's important that you go through that. But by week 6, there shouldn't be any foods that you can't or shouldn't be having post-surgery. It doesn't mean that you can't incorporate foods that you love in moderation. It just needs to be in part of that balanced diet. Pregnancy, so you can't have children after weight loss surgery. So for this, we'd recommend you wait 18 to 24 months post-bariatric surgery before pursuing with pregnancy. That's to make sure that you are on your weight loss journey and you have a good nutritional profile for pregnancy to go to full term. On this note, fertility can increase in both males and females as a response to weight change post-bariatric surgery. So it's not uncommon for your consultant surgeon to discuss contraception with you at your appointment. Patient expectations. So these are the things that we're looking for when booking in a patient for surgery. So your weight is tracking down. This can feel a bit like a trick question, but hopefully with you engaging with your everything from tier 3 and now introducing the tier 4 eating techniques, is applying everything that you know, and that surgery is that tool. So keeping your weight on a steady or downward trend. Okay, that you stopped alcohol or smoking if that's appropriate to you. You tried the liver reduction diet for 7 to 10 days and are confident that you can complete that for your 3 to 4 weeks. You engage with eating techniques, you have that regular meal pattern, you cut out your fizzy drinks, and you know about, and you've been practicing the 20-20-20. You understand the post-surgical care, excess skin supplementation, and you're attending your dietetic follow-ups. Okay, so surgery does not guarantee long-term weight loss, and its success depends on lifestyle and dietary changes. So just a few reminders of some important principles regarding the eating techniques. So just picking a few things to work on and discussing them at your follow-up appointments. Pathways, everyone wants to know, and I appreciate you've all done the tier 3 prior to this education session today. So we all get you in for a one-to-one weight check, an appointment with our specialist dietitian to get that baseline weight. They can set particular goals for you and discuss, and you can that's the opportunity to discuss on a one-to-one basis your reasons for surgery or any concerns that you have. Okay, we'll then see you in the follow-up clinic to see how you got along with any targets set from the dietitians. We do like to see you in face-to-face appointments, probably every 2 to 3 appointments, just that face-to-face weight check. So once you're meeting those sort of patient expectations, we can book you in to see our consultant surgeon. By that point, hopefully you have an understanding of which surgery you'd like and why. He'll definitely ask of your preference, and then hopefully add you onto the waiting list. So currently our waiting list is approximately 9 to 12 months long, and we'd still follow you up whilst you're on the waiting list for active monitoring and for any updates you've got for the team. So we'd say getting to that surgeon appointment is very much in your control on how engaged you are with the pathway or how long it takes you to engage with those eating techniques or cut down on your smoking. However, additionally, there are things that we need to establish pre-surgery. If some patients need to be referred to the Dorset Sleep Clinic for investigations for obstructive sleep apnea, if they need to be on a CPAP machine, and having your diabetes well managed as well. So these are books by Denise Ratcliffe. She's one of the clinical psychologists in London. Would really recommend that these books have a little read through. Gives a good patient stories of what it's like pre-surgery and also post-surgery. And this is a quote from one of our surgeons: "Surgery is just a drop in the ocean. It's the day of surgery is a moment in time. It's the preparation around it that has the potential to meet your long-term expectations if these are set correctly." I think this is super important. A lot of patients want surgery sort of now, yesterday, as soon as possible, and actually it's making the most of this pre-surgical workup. It's not here to be seen as further hoops you need to jump through. It's all here for you to make the most of bariatric surgery, for you to be in the best place both physically and mentally ready for making the most out of your journey.